Welcome to the Ask the Expert Show with local celebrity host Steve-O. Sit back each week while Steve-O educates you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O with today's expert in their field.
Hey, good afternoon. Welcome to another Ask the Experts, where we bring you experts in the field of legal, health, financial, and home improvement. I love today because I am 60-ish, young 60-ish, and we are doing an anti-aging show today. I have the co-founder and managing director, James Ritchie of Anti-Aging and Wellness Clinic, and this is his second show. We do a show with him every month, and for the next 30 minutes, we're going to talk about anti-aging. And welcome, first of all, James.
Great to be here. Thank you.
I'm so glad you're here. See, I've actually done this program, so I understand it, and it is probably the greatest program I ever got on. Now, the only thing I did wrong is that you really need to be on it 6 months to a year, and I was only on it for 3 months, but what I saw from 3 months, but tell everybody, how did you get involved with this?
Well, I was semi-retired in Costa Rica. I'm 53.
Rough life.
Yeah. Right.
Hot water's horrible there.
And just because I was involved with anti-aging for about 24 years from my own personal research. I come out of the telecommunications industry, studied anti-aging. My father was 48 years of age when he had his first heart attack. So that drove me to just do as much research, because I learned when he had his heart attack that even though we were dealing with some of the considered the best medical professionals in the Chicagoland area, that some of the information we were getting is not what we wanted to hear, in particular about the longevity in life that he might have being a 48-year-old individual back in 1989 that suffered a heart attack in the hospital.
You know, I wanted to ask you today because there's some new figures coming out. It was getting to the average age was going up and up, but now it's starting to come down.
Yeah, I think this might be the first.
When I read that.
This might be the first time in human history that we've seen longevity actually decline a bit.
Why do you think it is?
Well, I think that anybody that's over the age of 40 right now, or 50 even. We were introduced, it was the 60s generation, 70s generation. That's when we really got an onslaught of processed foods. And I love to talk a little bit about the history, but I don't want to go too far down that path. But I do want to mention, out of World War II, we needed to engineer foods that were very lightweight, that were packaged, that would have a long shelf life, so that we could send that economically to the GIs that were fighting in Europe and the Pacific. So because of that, a lot of technologies were developed. So when our generation started to grow up, we had, we'd go in, we'd see cookies in a box, we'd see rice in a box, everything was in a box, it would last on the shelf. And besides that, we've seen a fast food industry that's grown. So
yes.
Even though, statistically 80% of the people think they eat relatively healthy, we're really eating about, overabundance of processed foods, too much, in my opinion, meat and dairy, and all of that's, it just leads to chronic disease, and we're seeing an epidemic of chronic diseases.
Well, I know that working out is important too, but a lot of people, I myself have gotten so lazy because we sit in front of the computer all day. Look, even kids nowadays, we used to have parks and sidewalks. They don't have that anymore. But I think as a society, we have gotten lazier, which definitely, but I also know that food is 80% of it, though, too. Very important.
Yeah, I believe it's, we've done some research. In particular, there's a Dr. Esselstyn out of the Cleveland Clinic. He's been doing, heart reversal type research and blood pressure reversal, things like that. And what he determined is he put people on the diet and didn't require them to do any exercise. So he learned from his research that exercise actually plays a much smaller component than the diet component. And in fact, there's been some other research studies that I don't have the information just off the top of my head, but in a sense, what they showed is that, if you just modify your diet to the proper diet, it's like doing, 15 hours of exercise a week in some cases.
You know what? I used to tell, just if you can just walk,
right?
You don't have to even go to the gym, but the diet was the most important thing. So tell everybody now, you have this clinic, and it actually, because we have people from all over the United States.
We have 4 clinics.
You have 4 clinics.
Yeah.
And people from, actually, we get a lot of New York people that listen to our show. Tell us about your clinic.
Well, the clinic is in medical tourism destinations. We're in the number 5 medical tourist destination in the world, which is Costa Rica. We have 2 clinics in Costa Rica. We have another clinic in Mexico. We're in the process of opening another clinic in Panama, Panama City, Panama. And then now we're actually going to be moving into the United States in the Kentucky area first, because of the relationship that we have with one of the great, I consider him one of the great anti-aging physicians, and we're going to bring him down to Florida as well, and we're going to start delivering services in Florida.
Now, if you're in New York now, you can actually do this over the phone. I did mine over the phone. The first thing you're going to do is do a complete blood workup. Is that right?
Right. I mean, a lot of it you can do over the phone. In fact, they can do surgeries, remotely in the war zone of Iraq from people in New York using a Deficiency type surgical machine. So technology's really brought us all together no matter where we're at. Now, because of the legal issues, and, there's some bad players in the industry, right? There's some people that are not exactly the most ethical when they're doing their service. And so, in a sense, we really need to have that physician-patient relationship established. So that requires the first visit be face-to-face with the physician. He needs to know you, understand what you're all about, listen to what your symptoms are, really spend some time, and then do the very comprehensive blood testing and perhaps some other testing depending on what your symptoms are. And then from there, try to craft a program that's going to help you avoid chronic disease. Potentially, if you really want to go, hardcore, reverse chronic disease, which we can, now there's research in the literature. People are doing it. We are doing it. You can reverse heart disease with diet. You can reverse type 2 diabetes with diet in many cases. And it really is a matter of just educating the patient on what they need to do. And then what we can do also is add a lot of the anti-aging modalities, which can be bioidentical hormone replacement therapy, supplementation, to actually hit this kind of attack it from various angles to where we can get a much better result in patients sooner.
James, I never knew that young people could have low testosterone too. I thought it was someone who had to be older,
right?
But that's not true.
Well, anymore, like I said, we've grown up in the newer generation, and the newer generation, more access to processed foods. Every generation, I think, is eating worse. We have an obesity problem in this country, 7% overweight and obese.
That high.
Yeah, and never before in our history, probably the history of the world, have children now they have an obesity problem, and it's getting worse.
That's what I hear.
So, as you mentioned, it's got to do with the sedentary lifestyle, too many video games, not getting it out enough. And also what happens with that is, like we said, the food's a big component. When you're not getting outdoors, I remember when I was a kid, I was outdoors, especially when school was out, 7 o'clock in the morning until 7, 8 o'clock at night.
Exactly.
And, my parents had to come find me. Nowadays, a lot of children are spending a large percentage of their childhood inside the house.
Inside. I know. It's really sad. So can you walk us through the program once someone contacts you? Sure. Where do you go from there?
Well, once they contact us, we kind of explain, what the whole thing is about. Because a lot of people, they just think, okay, I want to get bioidentical hormone replacement therapy, maybe a little bit of nutrition. They don't really understand. Others understand a little bit more. So we try to give them as much information as possible so there's no surprises once they launch into the program. We schedule a visit for them to come and meet with the doctor. Sometimes we'll do the blood test ahead of time for certain individuals because a lot of times insurance will cover a portion of that blood test.
That's interesting.
Or a lot of the blood testing. So in that sense, they can save a few $100s here or there for that. And then they'll meet with the doctor. The doctor will sit there and look at their blood work in front of them. He's going to list. They fill out a questionnaire. Usually, it's a very detailed questionnaire. What's your family history? Have you ever had any of these types of problems? Any surgeries? We've all kind of done that when we've walked into a clinic. And then the doctor kind of takes all of that and tries to, put two and two together and diagnose what's really going on with you.
The blood work really tells you a lot, doesn't it?
Well, it can point out some obvious things. Blood work cannot do it 100%, but what it can do is sometimes you might get a patient in that's not telling the whole truth to you, because they may have some incentives to try to get medicated when they may not need it. So through that conversation that you're going to have with the patient, you're going to find out a little bit more about what's driving the whole thing. And the blood tests definitely help confirm it.
So you talked about there's some clinics out there that aren't, I don't know how on the up and up. I mean, they get you to do more things than maybe you really need. But why is your clinic? Tell me why I should come to your clinic over every other clinic.
Well, constantly, we really want to grow this into something exceptional. So constantly what we're doing is looking at what the competition's doing, and then we're looking at what we're doing, and we're making sure that we're going to be doing what's really the evidence-based information that's on the cutting edge. And what that entails really is the type of diet. Most of our competitors are still, I would say, 10 to 15 years behind in the diet knowledge, okay? I think we're on the cutting edge of the diet knowledge. I think you're going to see in the next 5 years a lot of the realities that we thought were true in the past completely change. People are going to understand a lot more about what the role diet does play in our health and wellness. And I think a lot of that information has even been suppressed in some cases because we have a lot of strong lobbying and special interest groups that want to protect their areas of business.
Well, one of the things that I noticed is that a lot of people seem they were just going there to lose weight. And this does so much more. It's not just about losing weight, is it? In fact, you were just talking about possibly reversing heart disease because of the diet.
Exactly. Most people that do reverse heart disease also lose a lot of weight. So and that's because we're teaching them how to eat. We're teaching them what their species is and what the perfect diet is for that species. And then we try to educate them on how to make food that might be different than what they're accustomed to. But it's really kind of like the beans.
How to make foods too.
Well, we provide them with recipes, right? Because what's funny is that you can, we try to take meat and dairy out of the diet especially if you're on a heart reversal program. The only heart reversal program that's worked from a nutrition point is a whole food, plant-based diet. That means not processed foods. Okay. That means not meat and dairy. Okay, so what we've got to do is...
What about chicken or fish?
No, chicken or fish, that's all the same thing. When it comes to reversing heart disease, we've got to get all saturated fats out of the diet and all cholesterol out of the diet.
Is this vegan? Is this like a vegan?
It's vegan, but you can be a vegan and eat Dunkin' Donuts. Okay, so the thing is that we want to eat vegan, but we want to eat nutrient-dense foods. So we want to build meals around beans and greens, ideally. Beans and greens and some greens, whole grains. And when you do that, then we have some tricks that we can teach people. It's a matter of education. It's really great stuff, and it's simple, but we can make salad dressings. We can give you good salads. We can do vegan pizzas. We prefer, to limit that because we want to limit as much processing as possible. We want it to be just like it grows in nature. That's the ideal. Maybe cook it a little bit in some cases. Generally, we recommend about 50% of your food be raw. The other 50 be cooked into soups and different things like that.
And you're on this program yourself?
I've been on it for about 3 years, yeah.
Okay. Is it hard to do?
It's hard to learn it. It takes about 72 hours, we found, for people to, and you got to have motivation to learn it, right? So that's where it's great. If you're thinking about going in for bypass surgery and you really study the statistics related to bypass surgery and angioplasty, some of us in this community that believe in reversing heart disease in patients almost consider that the cardiologist not introducing this diet as an option to the patient is a form of not providing full consent about what their options are.
I actually had a cardiologist come on a morning show, and I was really surprised because I agree with you. Diet is so important when it comes to your heart. And this guy, I'm telling you, he weighed over 300 pounds. Right. And this was a cardiologist. Yeah. So it seems like maybe the cardiologist needs some education too.
doctors die young, they say.
Yeah.
You know, and a lot of it is because they're very busy. They have a very stressful life. They don't have a lot of extra time, so they're not taking the extra steps. And really, we know this now because we have an epidemic. I mean, our two leading killers are cancer and heart disease. It's all related to lifestyle, almost all of it. I don't want to say 100%, but I would say probably 95%, because we know in certain populations around the world that eat predominantly a whole food, plant-based diet, don't have these types of problems.
Wow. Well, we're going to go to break. Give everybody your website address.
Okay, I encourage everybody to go read
Got
our
a great
blogs.
website.
Yeah, www.antiagecr.com, www.antiagecr.com. Go there, read the blogs, learn what you can do.
And how can they reach you by phone?
Well, there's an 800 number on the website. Because we have so many clinics, I don't keep track of all the 800 numbers.
Okay. So just go to the website.
Just go to the website.
Everything's on there.
Exactly.
We're going to go to break right now. When we come back, I want to talk about cholesterol when we come back.
Okay, excellent.
We'll be right back.
Thank you.
The Anti-Aging Wellness Clinic is the leading international medical group with treatment centers in key medical tourist destinations. Currently, they have 2 treatment centers in Costa Rica, 1 in Tijuana, Mexico, and a 4th under construction in Panama. Their treatment centers are staffed by the most experienced anti-aging team in the Latin America region. The physicians are board certified by the American Academy of Anti-Aging Medicine. The centers concentrate in many different anti-aging therapies: bioidentical hormone replacement, BHRT, facial and skin rejuvenation, medical weight loss, as well as vitamins and supplements. Human growth hormone replacement for AGHD is one of our leading treatments. The Anti-Aging and Wellness Clinic's mission is to safely and effectively get their patients on the fast track to optimal wellness. By doing so, ultimately helping them to avoid unnecessary common age-related chronic diseases plaguing the United States. The health of Americans, and the U.S. healthcare system specifically, is spiraling out of control. Costs are growing and in many cases not affordable for elective procedures. With an overweight, obesity epidemic approaching 70%, chronic diseases are growing more rapidly than the healthcare system can support. To learn what they can do differently for you, go to antiagecr.com or call 800-657-7950. With
James Ritchie, we're talking about Anti-Aging and Wellness Clinic. This is very dear to my heart because I've actually tried the program and it definitely works. We're talking a lot about nutrition because that's so important. And I want to talk about cholesterol. What do you recommend when you come to fighting cholesterol?
Well, I look at it like there's 2 things going on right now. There's consensus-based medicine, which is kind of like following what the consensus is among the medical community, the mainstream medical community, and there's evidence-based medicine. And I try to say we tend to lean on the evidence-based even more than some of these others that claim they are, but in a sense, they're still treating people in a consensus-based paradigm. And if you look at any of the literature, heart disease is only avoided and stopped if your total cholesterol is 150. And generally, we like to see the LDL, which is the oxidized cholesterol, to be 70 or below, even lower than that. The lower the better with the LDL, because that's the cholesterol that gets oxidized. And when that cholesterol gets oxidized, it actually builds sharp crystals. And what those sharp crystals can do is puncture through the plaque. And because we have blood pressure, when something punctures through a plaque buildup in our heart, the blood pressure, the flow of the blood, rips that open. When it rips that open, that's going to then coagulate because you're going to send healing factors there, okay? And everything's going to coagulate. It's going to make a blood clot, and then you're going to have a heart attack event.
Wow. So what do you think about statin drugs?
Well, if we keep the cholesterol at 70 or 60, the LDL, the oxidized cholesterol, which is the bad cholesterol, at 70 or 60, we would probably not recommend continuation of statin drugs because
I'm hearing that more and more.
Right. We know that people that have been on statin drugs for a number of years have a higher chance in some studies to develop type 2 diabetes. Okay.
Wow.
So we're kind of like it's kind of like when you're using nature to heal or to help people get better. It works so much better than when you use a pharmaceutical, medication and try to make them better. So if you try to drive down cholesterol just with statins, a lot of the studies that come out don't really show a major benefit. I mean, if you've already had a heart attack and they start giving you statins, I mean, we would recommend that. We definitely recommend it in people that are unwilling to move to the diet to try to control the cholesterol, like the mainstream medical community. But we really strongly want to educate them in that, to let them know, because many of them don't, diet can really take this and whip it. I mean, Dr. Esselstyn, one of the guys that did the original studies back in the 80s and 90s, I mean, he said this is a paper tiger, and it really is. If people are educated on what to eat, they can totally take control of it, and it happens much faster than people realize. Even if you've had heart disease and you're 60 years old, 70 years old, or even older, they're seeing that they can actually stop it in about 3 months, to where they pull you out of the danger zone, okay? And the way they can pull you out of the danger zone, is because they're giving you the diet, if you're following the rules of the diet, and with statin drugs, they can get that oxidized cholesterol so it's not oxidized. It starts to get down to about 70 milliliters or milligrams per deciliter or lower. And once it's there, we know it's not oxidized and sharp, and it's less likely to break open a plaque.
What about vitamin C? Does that help heart disease?
Well, vitamin C is interesting. Linus Pauling was a two-time Nobel Peace Prize winner. He won his first one in chemistry. And back in the 90s, late 80s, early 90s, he came up with this concept where he looked at every animal on the planet, and there's certain animals that synthesize their own vitamin C, so that just naturally their body synthesizes it. Primates, the higher-end primates like ourselves and gorillas, we lost that gene way back, probably millions of years or hundreds of thousands of years, okay? We lost that gene to synthesize our own vitamin C. So we have to eat to get the vitamin C. But whether an animal synthesizes their own vitamin C, or if we look at primates in the wild eating the vitamin C, or eating foods that have the vitamin C in it, we notice that they get usually around 8 grams a day, if not higher. It's around 8. It could be 13 grams a day. It could be 5 grams a day. But typically in a well-rounded diet for a wild primate, or even other animals, for example, I believe a pig will synthesize their own vitamin C, and it will be like 8 grams a day that they'll synthesize in their body. Wow. So when he looked at every species on the planet, Linus Pauling determined that everybody had around 8 grams of vitamin C a day, so he started saying human beings should be taking much more in their diet and in supplementation, because the RDA, the recommended daily allowance, is only around 60 milligrams of vitamin C a day. 60 milligrams of vitamin C is not even 1 gram, okay?
So how does hormone replacement then help heart disease?
Well, what we do is we use niacin, okay? When we look at cholesterol, we have the LDL cholesterol, which is the bad cholesterol, the oxidized cholesterol, and then we have HDL cholesterol. HDL cholesterol is the good cholesterol, and that's the cholesterol that we kind of look at like the mop-up crew.
Okay.
That cholesterol, when it circulates through your bloodstream, it cleans up the excess cholesterol, which would become oxidized otherwise. So if you drive up HDL cholesterol, you can help clean up. It's like putting more cleaning people in there to clean up the oxidized cholesterol. And so with niacin, which is a supplement, they've actually done some studies, and they've seen significant increase in HDL. So that means you're cleaning more. And so we want to lower the LDL with diet, increase it with niacin. Now, where hormone replacement comes in is we know risk factor is for heart disease and heart attacks based on data collected by the Framingham Heart Study is closely correlated to body composition. And if there's one thing hormone replacement can do for people that are following a good diet and doing exercise and on hormone replacement therapy, is body composition transformation. For example, the great Rudman study on HGH showed that men from 61 years of age to 81 years of age that were in the study that took HGH for 6 months lost 14.4% body fat and gained 8.8% body mass. So more muscle,
amazing.
Less fat.
So I was telling you before the show, I was on the Morlun. Mm-hmm. That was one of the other.
Exactly. Mm-hmm.
Tell people about Morlun.
Well, what happened with human growth hormone in the United States is that we got fear-mongering. We had athletes in the early or mid-'90s or whatever that began doping and abusing it. And so this got bundled in with anabolic steroids, and Congress passed some very strict laws. So it's very difficult for many people to get human growth hormone prescribed, even though they may have true deficiencies. In fact, some research is showing 50% of the people, because we live on the standard American diet, which isn't that healthy. We are 67 to 70% overweight and obese. That means our hormones are not operating efficiently, right? So it's even that much harder for people to get in shape as they get older, much harder than it would have been in past generations. So with Sir Morlun, the way it works is it stimulates the growth hormone releasing hormone in the pituitary. So your pituitary gland is what is going to produce human growth hormone. But it has a stimulator that triggers it. It's a big feedback mechanism, almost like a transistor in a radio product. I mean, you feed it in and it amplifies the end result to be human growth hormone. Sir Morlun, what it will do is it will push the pituitary gland. I think of it like a horse and buggy. You're taking a whip and you're whipping the pituitary gland, signaling it to produce more HGH. What we generally find is that Sir Morlun gives very subpar results in most people, because the reason their HGH is low is because their pituitary gland isn't functioning that well to begin with. So if we just try to beat it harder, and it's an old horse and it's not ready to run, it's not going to win the Kentucky Derby.
Now, believe it or not, we've got less than 2 minutes. Give everybody just an idea on cost.
Okay, well, for about $3,000, you can get into a 6-month program. It's about $29.95, and what we're going to do is give you nutritional
counseling. That's for 3 months.
No, that's 6 months.
6 months.
6 months. And what that's going to do is it's going to be the basic hormone replacement therapy. It's going to be nutrition. And again, we've got to test and make sure people need it. You just don't come in. It's not 7-Eleven.
Right.
You don't come in and get your hormone therapy. But by and large, a lot of people will have deficiencies. We're gonna study those deficiencies. We're gonna optimize those deficiencies to upper physiological levels. And so for $3,000, you can look at about a 6-month program with that, and then get the coaching for the exercise and the nutrition on top of it through telemedicine. So once we establish the physician-patient relationship, we're going to be coaching them over time with more interactivity between the physician through that time, like on weekly visits, and the nutritionist and a wellness coach.
Okay. Wow. You give out a lot of educational information. Just the diet part alone.
It's a revolutionary approach to healthcare.
And the price really isn't bad. I mean, that's for 6 months. So the price is not bad at all.
I remember they were saying Super Bowl tickets go for $4,000, $5,000. Yeah. And, wouldn't it be better to get yourself into shape and eliminate the risk factors that might kill you so you can spend more years with your family? I mean, how many added years do you think? We know from risk studies that have been done in the Framingham Heart Study, I know we're short on time, but from the Framingham Heart Study, we know on the risk factor calculations, if we can reduce those from 20, 30% risk factors that you're going to have a heart event in 5 years, that we can push that down into the 5-10% range.
Give everybody your website address.
It's www.antiagecr.com, www.antiagecr.com.
And your phone number's on there.
The phone number's on there.
And if people have got questions, I'm sure you have some kind of a free consultation.
Mm-hmm.
Folks, I'm going to tell you something. If there really is anti-aging, this really does work. And
it does.
Give them a call. Give James Company a call. He's the co-founder and managing director of Anti-Aging and Wellness Clinic, and he'll be back with us again. I could do this for another hour, easy. He'll be back again with us next month. And one more time with the website,
antiagecr.com.
And when we come back, we got another half show, and we'll be right back.
The Anti-Aging Wellness Clinic is the leading international medical group with treatment centers in key medical tourist destinations. Currently, they have 2 treatment centers in Costa Rica, 1 in Tijuana, Mexico, and a 4th under construction in Panama. Their treatment centers are staffed by the most experienced anti-aging team in the Latin America region. The physicians are board certified by the American Academy of Anti-Aging Medicine. The centers concentrate in many different anti-aging therapies: bioidentical hormone replacement, BHRT, facial and skin rejuvenation, medical weight loss, as well as vitamins and supplements. Human growth hormone replacement for AGHD is one of our leading treatments. The Anti-Aging and Wellness Clinic's mission is to safely and effectively get their patients on the fast track to optimal wellness. By doing so, ultimately helping them to avoid unnecessary common age-related chronic diseases plaguing the United States. The health of Americans and the U.S. healthcare system specifically is spiraling out of control. Costs are growing and in many cases not affordable for elective procedures. With an overweight, obesity epidemic approaching 70%, chronic diseases are growing more rapidly than the healthcare system can support. To learn what they can do differently for you, go to antiagecr.com or call 800-657-7950.